Not by Nayak, Sylvester Stallone edition. For those of you like me who grew up in the 70s and 80s and even 90s to a degree, Sylvester Stallone is iconic. He is a epitome of a macho movie hero, movie star, and he has had some very interesting plastic surgery, at least I believe he has. And he also has an interesting lifelong things that are unique about his face. So I think he'd be a great one to do, and I hope you enjoy it. So when you think Sylvester Stallone and you think of the way he talks, I mean, he's a handsome guy, but he has a very, very specific thing that whenever you see a Sylvester Stallone impersonation, you're going to see someone take their lip and make it this kind of crooked shape, right? This is Sylvester Stallone's absolute calling card. It's his crooked lower lip. And so let's take that apart. I've heard that, as you know, that's been there since he was a young man. So I've heard people talk about that as a facelift injury, because sometimes with a facelift we can have temporary or even permanent lower lip crookedness after a facelift. It's not a facelift injury. He's had that since he was a youth. I've also seen people describe that as potentially a birth injury. They used forceps, or it was a rough birth and somehow injured a nerve there. That's pretty unlikely. Crush injuries of the nerve, the marginal mandibular nerve, typically return in a few months. So that is probably not a crush birth injury. What that most likely is something like this. So this is a little baby that has Sylvester Stallone's lip shape. And what's going on is this part of the lower lip pulls down correctly when she's crying, but this part of the lower lip fails to pull down. So the whole lower lip pulls down this direction, and it looks kind of diagonal, just like Sylvester Stallone's lower lips. So what is that? Well, there's a condition where some of the muscles that are supposed to pull down at the lower lip, especially this depressor anguli oris, pulls down at the corner, and there's depressor anguli oris again, pulling down at the corner of the lip, and then here's depressor labii inferioris. These muscles, in some children, fail to form on one side. And they are otherwise totally normal. There's nothing wrong with these kids. This is just a failure of one or both of these muscles to form. And when that happens, you can imagine, when they're crying, this set of muscles pulls down really well, and this set of muscles is absent. It isn't doing anything. And so what do you get? You get the name of this condition. This condition is literally called asymmetric crying facies, ACF, asymmetric crying facies. And that's what I believe Sylvester Stallone has. I think he is born with a missing muscle there. What happens if you have that? Nothing. You live a normal life. If it really bothers you that your smile and speech is crooked, what we can do is put a little bit of Botox in the muscle that works to weaken it as well. And if you weaken this muscle, then the lip ends up being straight again. We also use that after facelifts. If we see temporary or long-lasting lip weakness after a facelift, we can actually use Botox on the other side to bring them back into balance. So that's part one of Stallone's unique shapes. Part two is complicated. Part two involves, I believe, lower eyelid surgery together with his pre-existing eyelid shape. So if we look at this more recent picture of Sylvester Stallone, he's got some unusual shapes in his eyelid. One, his inferior limbus is exposed. And what's the inferior limbus? The limbus literally means edge. Okay, so when we talk about the edge or boundary is a better word for it. It's the boundary between the iris and the white of the eye, between the cornea and the sclera. And it is not normal or not common to be able to see the bottom edge of that when the person is in primary gaze, just looking straight ahead. You can see the bottom edge, his inferior limbus, and you can see the inferior sclera. Okay, so we call this inferior scleral show. And why are we seeing this? We're seeing this because his lower eyelid is hanging down. It's way too low on his eye. This is a common complication after lower lid blepharoplasty done with a skin muscle flap or an anterior or a skin incision approach. So if you looked at my lower blepharoplasty videos, you'll notice that I almost never put an incision on the front of the eyelid. That's not because I'm afraid of bad scars. My scars are great. It's because of what we're about to learn. So he's got inferior scleral show. The lower lid is hanging down. We also call this lateral rounding because instead of having the kind of almond-shaped boundary to the lower lid, the lateral or side part of his lower lid is rounded out. So lateral rounding, inferior scleral show. The other thing he has is phimosis. So if we look at where the left to right distance in his eye is, the iris is no longer centered in the middle of that. It's off to the edge. And it's not that the eye has drifted forward, it's that the corner of his eye has drifted inward. So the corner of his eye belongs out here by the eye bone. So let's look at all these anatomical things together and see why this is. So Sylvester Stallone, this part is congenital, meaning from birth. He's got a very concave midface. Midface being the area defined by the corner of the eye to the corner of the lip. We call that the midface. So his midface is very concave. When we look at that from the side view, this area again being very concave, his cheekbone is sitting back behind the plane of the cornea. And so there's not a lot of support for this soft tissue because the cheekbone is sitting back behind. You can see that concavity right here. So when he has lower eyelid surgery, why did his eye hang down? Well, he has poor support there, and a traditional lower eyelid surgery makes an incision from the front of the eyelid right back here to get to the fat bags behind this muscle layer. Okay. The problem is this muscle layer, when you make an incision across it, it gets really angry. That muscle layer, here it is on this picture, its job is to hold the floppy lower eyelid up against the eyeball. It's like a magic trick. The eyelid's this floppy membrane, the tiny bit of cartilage in it, but the tone of this muscle helps hold it upright against the eyeball. Well, when you come through here and make an incision across that muscle to get to the fat bags, guess what happens? The nerve endings that are giving this muscle tone come up this direction. You can see them on this diagram. And when you make that incision across here, all of the muscle above that incision, which is responsible for holding the eyelid up in the right position, it becomes paralyzed. Okay, and so that paralyzed lower eyelid, instead of sitting up at this prettier normal angle, it ends up hanging down. So people say, oh, they had too much skin removed. Could have had too much skin removed, but more likely it's actually the paralysis of that part of the muscle from that anterior approach to skin surgery. The other thing that we see, again, is that shortening of the distance from here to the outside corner. It really needs to go all the way out here as far as the width of his lid. We call this condition phimosis. And this is a very good example of it. So here is what phimosis looks like. There's the shortened lateral canthus, the shortened outer edge, and this is what it's really meant to look like. And this is just an example of a diagram from a textbook about how one way to correct this phimosis. So he's got two telltale signs of an older style of lower lid blepharoplasty where you come through the front. He's got the incision line. You can't see that as well. That's not the real problem. But the lateral rounding and phimosis, right? So if you want to see a more modern way to do that, the way that I prefer to do it, look at my lower eyelid video, which talks about a permanent way to kill bags, dark circles, and wrinkles, and you'll see the approach that I take that pretty much eliminates the risk of both of those conditions. All right, last couple things we're going to talk about in Sylvester. His ear. So he has, in my opinion, had a facelift. And this is, I think, pretty obvious. So there's a piece of cartilage just full on missing here. So even if you're not an ear anatomist or a plastic surgeon, you can tell that that's just a weird shape for the opening to someone's ear. So what's missing? What's missing is this piece of cartilage called the tragus. And for those of you who watched my politician one, you know this already. The tragus, T-R-A-G-U-S, tragus. Tragus means male goat or he-goat or billy goat. And it's because this little thing reminded the ancient anatomists of a billy goat's chin, especially because in older men it grows little wispy hairs on it. So the tragus is outright missing on Sylvester Stallone's ear. This is his old ear on this side. So this is a pretty extreme example of tragal deformities. I spend a lot of time at the end of a facelift surgery doing a tragal reconstruction to make that as undetectable as I possibly can. The other interesting thing is, again, a skin texture. They didn't take full advantage of all the different places to hide incisions, so he's got this kind of double line forming right here. where the facelift was inset into the ear. That's less of a big deal. The big one, I think, is the missing tragus. Last thing here, only toupees have hairlines. What do I mean by that? Normal male and female hairlines are not perfectly sharp like this. I mean, this is perfectly sharp. There's not any error to it. There aren't little wispy extra guys here in front. There aren't little short ones that grow full length. Normal hairlines don't have a perfectly crisp edge with real heavy hairs all throughout. They have little fine paintbrush hairs that come inside the skin, just outside the hairline. It's kind of a wavy situation. So this is either a hair transplant or a toupee, in my opinion. And it's not terrible, but what gives it away is it is too regular. It's too sharp. That's not how nature grows hair. Again, you get a good look at his inferior scleral show here. You get a good look at his lateral rounding. You get a good look at his phimosis. Again, all real telltale signs of lower eyelid specifically, plastic surgery. So that was a quick tour on Sylvester Stallone. Here he is in more recent years. Again, the thing that he still has that keeps his identity is that lower lip, which I believe is the muscle that didn't generate when he was formed. Almost everything else is unrecognizable, and I want to take a minute to say this is not because of plastic surgery exclusively. Aging is hard. I'm starting to see it on my own face. Aging is hard. And one of my pet peeves is when they'll show people in their 20s, and then they'll show them after plastic surgery in their 70s and go, oh my God, look, she used to be so beautiful, and plastic surgery ruined her. Well, she's also aged 50 years, and we're doing the best we can. We, the people that are aging, and we, the surgeons, are doing the best we can. And it would be wonderful if we could create a restoration of someone's face so they look exactly like they did when they were 20. But you know what? That's not realistic. So sometimes we make trade-offs where they don't look exactly like they did when they're 20, or they don't look perfectly normal, but they look way better than if they hadn't had surgery. So I think a good thing to keep in mind is that when people are pursuing these things, they are hoping for the best. And when I'm doing them, I'm hoping for the best. And that doesn't mean that every procedure is completely perfect and completely undetectable, but it can make people look better and feel better. And I'm doing these educational ones as a way for you to see that a lot of the people that you know out in public have had these procedures done, and for you to see what some of the most common complications of these procedures are, and what steps that I go through particularly to prevent each one of these or see them coming, so that we, for instance, with a negative vector eye, there are things that could have been done to kind of lead the curve and prevent the phimosis and prevent the lateral rounding. That probably wasn't that well known in the 80s and 90s when they had the surgery done. Thankfully, now it's a better era, and we have better things we can do. So there's Sylvester Stallone, not by Nayak. I hope you enjoyed it. Please leave comments below as to what you thought. And if you have a particular celebrity or public figure that you would like